Hi, thank you very much for the overwhelming response which I have got for my first video on piles, that is part 1. So I am now encouraged to do this video which is going to be part 2, and this will discuss mainly about the surgical treatment of piles or hemorrhoids. So I would try to discuss mainly 3 types of surgeries which are the most popular ones that are done for piles. Of course, if you try to enlist them, there are about 10 to 15 different types of surgeries that are done for piles. But I will be speaking mainly about 3 surgeries. One is the conventional hemorrhoidectomy. The second is minimal invasive procedure for hemorrhoids, and the third is laser hemorrhoidectomy. So let's come to the first procedure, that is conventional hemorrhoidectomy. Conventional hemorrhoidectomy is a gold standard procedure, and this has been done since many decades now. In fact, it is one of the first surgeries that was done for piles, and it is still done in certain special situations. The hemorrhoids or piles are cut and then the base is ligated. We call it as a pedicle. So the advantages of this procedure is it has a high success rate. Since it is being done since so many years, surgeons have gained a lot of experience about this procedure, and this procedure gives you one of the best results. But there is a disadvantage of this procedure. This procedure is very painful to the patient. This procedure is done under some kind of anesthesia. You can say a spinal anesthesia or a general anesthesia. But soon after the anesthesia goes away, the patient you can expect to be in some kind of pain. So this is considered to be a very painful procedure. Patients do have pain which is maximum in the first few days after surgery, but over a period of time the pain goes away, and maybe at the end of 1 to 2 months the patient becomes completely asymptomatic. That is, completely there is pain relief. So until that period of time you can expect some amount of discomfort for the patient. So this is the drawback of conventional hemorrhoidectomy. So to summarize, conventional hemorrhoidectomy has the advantage that it is the gold standard procedure. It gives excellent results, but it has a disadvantage that it will cause pain to most of the patients. Now, in whom are conventional hemorrhoidectomy procedure done? So conventional hemorrhoidectomy is best done in patients who have got grade 3 or grade 4 hemorrhoids. So I had discussed about the grades of hemorrhoids in the previous video, but I'll just summarize it again. So grade 1 is where the hemorrhoids are just bulging into the lumen. Grade 2 is when the hemorrhoids come out of the anal verge on defecation, but spontaneously they do go back in. Grade 3 is when they come out while you're passing motions and you have to manually push them back in, and grade 4 is they come out and they do not go back in. So conventional hemorrhoidectomy is best suited for grade 3 and grade 4 hemorrhoids. Now second, we will be discussing about the minimal invasive procedure for piles. This is also called as MIPH. It is also called as stapled hemorrhoidectomy. Now this procedure is you can say a newer generation procedure, though this has also been there since approximately 15 to 20 years now, and this is also one of the best procedures for hemorrhoids. It involves using a stapler gun. The stapler gun is an equipment that is used only once for a single patient, and it costs somewhere around 25 to 30,000 rupees. It is introduced into the anal canal, and the stapler is fired. a chunk of tissue is taken. Basically, this tissue, the removal of this tissue eventually leads to shrinkage of your piles, and of course the bleeding also stops, and it has very good results. So this is just a basic summary of how the procedure works. But for us as patients, what is it important to understand is, when is the procedure done, what is the advantages of the procedure, what are the disadvantages of the procedure. So let us come to what are the advantages of the procedure. As compared to conventional hemorrhoidectomy, MIPH is a painless procedure. So the biggest disadvantage of conventional hemorrhoidectomy is the biggest advantage of minimal invasive procedure for piles, that is MIPH, also called stapler hemorrhoidectomy. Now, other than this, of course, the patient is going to be more comfortable and he can easily go home the next day itself. There is no wound that has to heal in stapled hemorrhoidectomy as compared to a conventional hemorrhoidectomy. So conventional hemorrhoidectomy generally leaves behind a wound. Stapled hemorrhoidectomy does not leave behind a wound. So this is the biggest advantage of stapled hemorrhoidectomy. What are the disadvantages of stapled hemorrhoidectomy? Stapled hemorrhoidectomy particularly has no disadvantage per se, but I would say that it is best done in grade 2 and grade 3 hemorrhoids. Stapled hemorrhoidectomy may be insufficient in grade 4 hemorrhoids. Sometimes we get away by doing it even in grade 4, but most of the times the stapled hemorrhoidectomy does not give a complete outcome in a grade 4 hemorrhoid. So you can say this is kind of a disadvantage of stapled hemorrhoidectomy, but they are best suited for grade 2 and grade 3 hemorrhoids. Now we come to the third procedure, which I am sure everybody is excited to know, and this is laser hemorrhoidectomy, because a lot of people are now hearing about laser hemorrhoidectomy or laser procedure for piles. It has been marketed extensively. You get extraordinary Bollywood actors who are promoting this procedure, laser procedure for hemorrhoids under particular brands. But yes, today we will try to understand again what are the advantages, what are the disadvantages, and when it is supposed to be done. Now, laser hemorrhoidectomy is a procedure wherein we use a laser beam to burn the hemorrhoid. So this is brief introduction to how it is done. Now, what are the advantages of laser hemorrhoidectomy? The advantages of laser hemorrhoidectomy, again, the biggest advantage is that it is practically painless. So again, when you compare it to conventional hemorrhoidectomy, stapled hemorrhoidectomy is painless. Laser hemorrhoidectomy is also considered to be a painless procedure. You might experience some discomfort, but it rapidly improves, and the patient goes home the very next day itself. Now, the other advantage of laser hemorrhoidectomy is, again, there are no wound, or there is nothing that has to heal after laser hemorrhoidectomy as compared to conventional hemorrhoidectomy. Now, what are the disadvantages of laser hemorrhoidectomy? This is an important section, so please listen to what I have got to say. Laser hemorrhoidectomy is best suited again for grade 2 and sometimes grade 3 hemorrhoids, just like the MIPH that I discussed earlier. Grade 4 hemorrhoids, laser hemorrhoidectomy is very, very insufficient to tackle grade 4 hemorrhoids. So it is only to be done in grade 2 and grade 3. Now, in spite of laser hemorrhoidectomy, there is a chance that the patient might still come back with hemorrhoids, maybe after a year or maybe after a few years or something like that. So you have to understand that this may not be a permanent solution to your piles. So I'll repeat what I'm trying to tell you is, laser hemorrhoidectomy might not end up being a permanent solution to your piles. So unlike conventional hemorrhoidectomy and to an extent even stapled hemorrhoidectomy, who kind of give you a lifelong relief from hemorrhoids, laser hemorrhoidectomy may not give you a lifelong relief from hemorrhoids. So you might end up in hemorrhoids after a few months to few years, depends. Now, second disadvantage of laser hemorrhoidectomy is that it can have certain unique complications which are not seen in the other two types of hemorrhoid surgery. One is formation of a perianal abscess, second is formation of a perianal fistula. So these two complications are very unique and happen only in patients who undergo laser hemorrhoidectomy as compared to MIPH or conventional hemorrhoidectomy. In MIPH and conventional hemorrhoidectomy, the most common complication is bleeding, which can be managed. In laser hemorrhoidectomy, it is not the bleeding, but it is actually unique complications like fistula and abscess, which can happen in laser hemorrhoidectomy. Third disadvantage is most often laser hemorrhoidectomy has to be combined with another procedure to tackle the piles completely. So just doing laser hemorrhoidectomy may not be sufficient. So we might have to ligate the base of the hemorrhoid, that is the pedicle of the hemorrhoid, and sometimes we have to do a procedure called as RAR, that is rectoanal repair. So in combination with laser hemorrhoidectomy, this gives a much better result as compared to just purely doing laser hemorrhoidectomy. So I hope you have understood that what are the advantages of laser hemorrhoidectomy, what are the disadvantages of laser hemorrhoidectomy. Now to summarize, let us go grade wise, and let me try to tell you which is the best way to treat as per the grade of hemorrhoid. When it comes to grade 2, grade 3, the best way to treat it according to me is MIPH, that is a stapled hemorrhoidectomy. Yes, they can also be treated, grade 2 and grade 3 can also be treated by laser hemorrhoidectomy. You have to understand very important thing, that grade 4 hemorrhoids most often will need a conventional hemorrhoidectomy. So the gold standard procedure is still sometimes needed to get complete cure from piles. So generally what I do is, in grade 4 piles, I combine MIPH with conventional hemorrhoidectomy. So I do the MIPH and then I also take out, combine it with the conventional hemorrhoidectomy as a hybrid procedure, which gives excellent results. So I hope that I have tried to make your concepts clear about the surgical treatment of piles, which are the 3 most common surgeries that are done, what are the individual advantages and what are the individual disadvantages, and how I would advise or prefer onto how to get treated with piles. I hope this video was useful, and if you like such videos, please do comment me, and I'll try to make more such educational videos. Thank you.